How important is medical education and training in the healthcare industry? Picture the human body as a complex machine and healthcare professionals as the skilled mechanics who keep it running smoothly. But just as mechanics need to understand the intricacies of an engine to fix it, healthcare professionals need to grasp the nuances of medical products to use them safely and effectively. This is where medical education and training step in. Medical education and training are like the blueprints and manuals for these mechanics. They are critical in the healthcare and pharmaceutical industries, providing healthcare professionals with comprehensive and up-to-date knowledge about medical products. From understanding the product's mechanisms of action to knowing its indications, contraindications, and potential side effects, this function covers it all. But that's not all. Medical education and training also involve creating engaging training materials, such as presentations, manuals, online modules, and other resources. These are designed to be easily digestible by healthcare professionals, ensuring the information conveyed is not just informative, but also engaging. The delivery of this educational content is equally important. Whether it's through live training sessions, webinars, online platforms, or in-person workshops, the goal is to cater to the preferences and needs of the healthcare professionals. Yet, this function doesn't stop at providing information. It also ensures compliance with regulatory standards, monitors changes in regulations, and updates training content accordingly. This means healthcare professionals can rest assured that the information they receive is always up to date and compliant with the latest guidelines. Moreover, medical education and training emphasize the importance of using medical products safely and effectively. They inform healthcare professionals on proper administration, dosage, and patient monitoring, thereby optimizing patient outcomes and reducing the risk of adverse events. In a nutshell, medical education and training empower healthcare professionals with the knowledge and skills needed to provide the best possible care to their patients. They play a pivotal role in promoting patient safety, product efficacy, and compliance with regulatory standards. Understanding the importance of medical education and training sets the stage for our exploration of its key aspects. The first step in medical education and training is developing the educational program. This is where the magic begins. The professionals in this field put on their creative hats to design programs that arm healthcare professionals with a comprehensive understanding of medical products. This includes dissecting the product's mechanisms of action, explaining its indications, elaborating on contraindications, and shedding light on potential side effects. It's about creating a holistic view of the product, so healthcare professionals can make informed decisions. This design process is meticulous and requires a deep understanding of both the product and the needs of the healthcare professionals. It's about striking a balance between technical information and practical application. The result is an educational program that is both informative and engaging, providing healthcare professionals with the knowledge they need to use the product safely and effectively. Once the educational program is developed, the creation of training materials begins. Creating engaging and accessible training materials is a critical aspect of medical education and training. We craft a variety of resources to provide healthcare professionals with comprehensive knowledge about our medical products. These include presentations packed with essential information, from a product's mechanism of action to its potential side effects. We also develop manuals, rich in detail and easy to digest, providing an in-depth understanding of the product. These manuals serve as a handy reference for healthcare professionals, allowing them to quickly seek information when needed. Our online modules take a more interactive approach, providing a dynamic and engaging learning experience. They often incorporate quizzes and interactive elements to reinforce learning, making the complex information more memorable. These materials are designed with a single purpose: to support our educational programs, ensuring that healthcare professionals can safely and effectively use our products. With our training materials in hand, we can now deliver our content. Delivering educational content is a key function of medical education and training. It's akin to the heart of the process, pumping out vital information to the healthcare professionals who need it. Now, the delivery of this content isn't a one-size-fits-all operation. It's tailored to fit the preferences and needs of the target audience. Some may prefer live training sessions, where they can interact with the trainer and fellow learners. Others might find webinars more convenient, allowing them to learn at their own pace. Then there are online platforms, which provide a wealth of resources at the click of a button. And let's not forget the traditional in-person workshops, where hands-on learning takes center stage. The key here is flexibility. The content needs to be accessible, engaging, and most importantly, adaptable to the varying needs of healthcare professionals. Ensuring compliance with regulations is a crucial next step. Medical education and training must comply with regulatory requirements and guidelines. This statement underlines the significant role of compliance in the world of healthcare. Professionals in this field have a duty to ensure that all training materials and programs meet the standards set by regulatory bodies. This is non-negotiable and is as critical as the educational content itself. To maintain this compliance, these professionals need to be vigilant, keeping an eye on any changes in regulations. They must stay informed about the latest updates and amendments, which can come from various sources. These might include new research findings, changes in clinical guidelines, or alterations in laws and regulations. Once they're aware of these changes, they then need to take swift action. This involves updating training content accordingly, ensuring that healthcare professionals receive the most current and compliant information. Through this meticulous process, we can ensure that the medical education and training provided are not just informative, but also within the bounds of what is legally and ethically acceptable. Now that we understand compliance, we can delve into the importance of product safety and efficacy. Training programs emphasize the importance of using medical products safely and effectively. This is not something that's left to chance. It's a crucial part of medical education and training, woven into every aspect of the learning process. Let's delve a bit deeper. These training programs are meticulously designed to cover all the bases, from the correct way to administer a product to the recommended dosage. They also highlight the importance of monitoring patients after administration. Why is this so important? Well, these three factors, proper administration, correct dosage, and diligent patient monitoring, can significantly reduce the risk of adverse events. For instance, administering a product incorrectly could lead to ineffective treatment or worse, harmful side effects. Similarly, giving a patient too much or too little of a product could cause undertreatment or overdosing, both of which can have serious consequences. And without careful patient monitoring, it's easy to miss signs of improvement or the onset of side effects. Through these training programs, healthcare professionals are taught to navigate these challenges. They learn how to administer products correctly, calculate the right dosage, and monitor patients effectively. This knowledge allows them to optimize patient outcomes and minimize risks. These programs also teach healthcare professionals about the specific safety profiles of different products. They learn about potential side effects, contraindications, and how to handle any issues that may arise. This is crucial because every medical product is unique, with its own set of benefits and risks. The bottom line is this: the safety and efficacy of medical products are not just about the products themselves. They're also about how these products are used, and that's where medical education and training comes in. It equips healthcare professionals with the knowledge and skills they need to use these products safely and effectively, ensuring the best possible outcomes for their patients. Recognizing and reporting adverse events is another critical aspect of medical education and training. Guidance on how to recognize and report adverse events is an integral part of medical education and training. Adverse events or side effects can sometimes occur when using medical products. It's crucial that healthcare professionals are equipped with the knowledge to recognize these events promptly. This swift recognition can make a significant difference to patient safety and in some cases could even save lives. Reporting these adverse events is just as important as recognizing them. Timely reporting allows for the collection of data that can be used to track, analyze, and ultimately prevent further occurrences of these events. This aspect of training not only contributes to the promotion of patient safety, but also to the efficacy of the product. When healthcare professionals understand the full scope of a product, including potential adverse events, they can make well-informed decisions about its use. This knowledge aids in the selection of the most effective treatment plans for their patients. Next, we'll look at the role of continuing education in medical education and training. Medical education and training programs often offer opportunities for continuing education. This is essential in a field as dynamic as healthcare, where new advancements and discoveries are made every day. It's not just about keeping up with the pace of change, but about mastering it. These programs are designed to ensure that healthcare professionals are always at the forefront of their profession, equipped with the most current knowledge and skills. Whether it's a new treatment technique, an innovative medical device, or an updated guideline, continuing education ensures that they are informed and ready to provide the best care to their patients. Moreover, these programs often provide healthcare professionals with the opportunity to earn continuing education credits. These credits are a testament to their commitment to lifelong learning and professional development. They demonstrate that the healthcare professional is not only up to date, but is also actively engaging with the latest developments in their field. Our final stop is the assessment and evaluation of our programs. Assessing and evaluating the effectiveness of medical education and training programs is a key function. Like any educational initiative, it's crucial to measure the impact of these programs. Here's how it works. Professionals in the field use various tools and techniques to gauge the success of their educational programs. This might involve quizzes to test knowledge retention, surveys to gather feedback on the learning experience, or observational assessments to evaluate changes in practice. The data collected from these assessments provide valuable insights into what's working and what needs improvement. It's a continuous process of refinement and enhancement, ensuring that the educational content remains relevant, engaging, and effective. Evaluation isn't just about maintaining standards. It's about raising the bar. It's about striving for excellence in education and training to empower healthcare professionals with the knowledge and skills they need. Through these key aspects of medical education and training, we empower healthcare professionals to provide the best possible care to their patients. So, we've discussed the key aspects of medical education and training. We've delved into the process of educational program development, crafting engaging and informative training materials, delivering content through various channels, and ensuring compliance with regulations. We've underscored the importance of product safety and efficacy, the need for timely adverse event reporting, and the role of continuing education in keeping healthcare professionals up to date. We've also touched on the importance of assessment and evaluation in refining these programs. Each of these elements come together to create a comprehensive and effective medical education and training function. This function is instrumental in promoting patient safety, enhancing product efficacy, and ensuring compliance with regulatory standards. It's all about empowering our healthcare professionals with the knowledge and skills they need to provide the best possible care to their patients. Remember, medical education and training is a crucial function in the healthcare and pharmaceutical industries, empowering healthcare professionals with the knowledge and skills needed to provide the best possible care.